Do you twist your ankle all the time? Because I tend to. That is called chronic ankle instability. When you tend to be walking down the road and just accidentally step off a curb and your ankle twists, or you're walking on uneven ground like at the park and you take a little step down and your ankle twists, that's chronic ankle instability. If you don't tend to treat it and make it stronger, it'll happen over and over and over. I used to have that when I played soccer. I would just be running down the grass and my ankle would twist, but it wouldn't even be painful because I do it constantly and it would just be kind of the new normal. But making sure you strengthen it and make sure it doesn't happen again is the key. And that's what like Steph Curry's doing. He's trying to rehab his ankle every time he has a problem. So let's go over some ones today. Okay, so first we're going to start with some easier balance exercises. So let's take a look down here. All right, so C3PO having some robot ankles. You got to make sure you get your feet as close as you can together. And this is kind of step one. You've got a narrow base of support, so just trying to stay steady. We're using an Airex pad today, so it's a little bit squishy. Step two is going tandem, or one foot in front of the other. Again, you're narrowing your base of support. You're going to try and switch to the other side, so doing both. And then step three is single leg. Again, switch it back and forth, just trying to make sure you're staying steady and not having your ankles wobble all over back and forth. So like I said, we're using an Airex pad here, but at home what you can use is a pillow. Fold up a pillow, yoga mat, something similar, and try and stand on that at home. All right, this next one is our intermediate level, a little bit more dynamic, so let's take a look at this one. All right, so these ones we're standing on what's called Oynadisks. They're filled with air, so a little bit more wobbly. And this is just a lightweight ball that we're going to try and use back and forth. So you're going to throw it and catch it. And that's going to throw off your balance one way versus the other, so you have to make sure you keep your stability. Ideally, you want to go for about a minute in each of these, but work your way up. If you're falling all over the place, it's more about form and trying to make sure you're staying steady than forcing yourself to do a minute and falling all over the place. Okay, so now our harder exercise is going to be doing squats on a Bosu ball. So today we're using a Bosu ball. I've got a chair behind me so we have something to aim to and to help you not feel as scared if you lose your balance. So you're going to do squats up and down, nice slow and control on the way down, and then pushing back up, which again, your ankles are getting a little bit more instability going, so it's going to work it back and forth. So we're using a Bosu ball today because it moves in a whole bunch of different directions. If you don't have a Bosu ball at home, try and see if you have them at your local gym, or if not, call your local PT clinic or come on in to Breakthrough Physical Therapy and we'll help you out.